So next, you were trying to tell me that I cannot get meningitis because I have not been in contact with the person. Okay. So to explain it in a better way, you can say it that it is actually an airborne infection that is usually transmitted when you are in close contact with the other person. You mentioned it that I have not been in contact, and that was the right explanation also. But just to add a bit of uniqueness to your consultation by adding the airborne infection in your consultation, this is going to make them strike here that okay, this person used this word. Okay, this is something new. This is something different. Everyone is going to say that you didn't have the contact for last 2 months, so you are not going to have. But there would be someone who would use okay, so it's an airborne infection that you are not going to get from quite some distance until you are in very close contact or in the same room, or just as you explained. Okay, so you can add this word here. This is not your mistake. This is just to add a few positives in your very positive consultation. Okay.
Okay.
All right. So and regarding the name, okay, let me tell you that there are a few times that we misinterpret the names of the patients, but that is a big no on your IPS. Believe me, because when you can see in your daily consultation, sometimes people do get offended if you forget their name or if you change their name on your own, and that is a thing that is going to give you negative impression in your IPS. So you also change the name from Annie to Anna in between your consultations that I noted. Okay, so you have the scenario in front of you on the table. So because we all are humans and there is limited capacity of our brain that we can remember things, and because of anxiety we do sometimes forget names or the age of the patient. So it is fine if you can have a look at the paper sometimes, maybe to confirm the name or age, maybe because we all are humans and they know that it's not it's very robotic if you are remembering everything. Okay, so just try not to miss the name, and for that you can have a look at the paper also. Okay,
Right.
Just to be sure that you are not going to cause any negative impression on your IPS.
Okay.
Okay, otherwise your consultation was very good. You asked me about my concerns and any other concern and all that, so I is very important. You could have asked me that why do you think that you might have got the meningitis, or why do you think that you need the prophylaxis? This could be idea part of the ICE. Okay, and I always say that at the end of the consultation, instead of, because you might have asked me about my concerns in between the consultation. So at the end of the consultation, if you want to ask another new question that, okay, if everything is being answered, or would you like to know anything else, always try to ask about the expectation. Okay, that is the safest way to end your consultation. That do you expect any other thing from me today? Do you expect any other concern to be addressed today? The patient will tell you, okay, I wanted this to be addressed as well, and you didn't. So you can come to that point. And it will also cover your ICE part. That has proper marking in your exam. Okay? So otherwise, it was a very well done consultation.
Thank you. Thank you.
So yeah, I'm really hopeful about your Dr. Pratibha, and I can clearly see the improvement in your consultation, and I'm really glad about that, and I'm really hopeful that you will ace this exam. Okay, all the best to you. So
thank you.
You're welcome. So just about for just a quick overview about this station for other candidates who might not have done this station. How are we going to tackle the station is we are going to first and foremost the grips. Okay, then she is here for the concerns, because it is written in the statement that addressing concerns. So ask about her concern. What brought her here today? what concerns her the most today, like our candidate performed. Okay, so she will tell you that I want antibiotics as a prophylaxis because my nephew has got this illness, meningitis. Okay, so she would want herself to be protected against that, and because her sister has got prophylaxis, she thinks that she also needs prophylaxis to keep herself safe from meningitis. Now you are going to increase your IPS marks and to boost your consultation and to build rapport with the patient. You need to ask about the nephew's health or any complications or the treatment that the nephew is on. And then Dr. Pratima very rightfully asked me about the last meeting with my nephew and the symptoms when my nephew was diagnosed with meningitis. So that these are the very important questions because these are going to decide if I am going to get my antibiotics or not. And these are the points that you are going to uh, tell me against my prescription of antibiotics. So these are your points that you need to ask so that you can use them in the management part to tell me that it is safe for me to not get the prophylaxis because I do not need them. Okay. So then ask about the symptoms. Try not to ask if you have any sinus symptoms of meningitis. Okay, it sounds a bit back term. Okay, so just ask: do you have any fever, any neck rigidity, any blurring of vision, any headache? She will completely deny all of these symptoms. Okay, then just quickly ask: do you have any other symptoms that you want me to know? Any other symptoms in any other part of the body, any pain anywhere you can even ask the cancer symptoms here, because just to have a quick overview of all of her body systems, okay, if you have time. Otherwise it is not very fun. Okay, so in PLAB aftosa, I always say the three things are very important: past medical history, medications, and allergies. Okay, these are the most relevant, and in this scenario occupation as well, because she is concerned. So Dr. Pratima very rightfully asked me about if anyone in my class has any of these symptoms, because she needs to know that if someone in my class might be having these meningitis symptoms, and I would definitely be needing prophylaxis then. So it was very good of her to ask me about my occupation in this case. Okay. So, like Dr. Pratima explained to me that it's very unlikely because I do not have any symptoms and I had no contact with anybody who had symptoms of meningitis recently. So there is no point in prescribing me with unnecessary antibiotics. Okay. So the management of this station is a bit of, you can say, counseling, because you need to counsel something, counsel the patient against what she wants from you. So it's a bit of counseling and convincing the patient regarding this. And how are you going to get your points? Strong points for counseling here is from your history. That is how you are going to build up your points, that since you didn't have any symptoms, since you are not in contact with your nephew, that is why you do not need any medications for now. Okay. And then about the vaccination. So if she is concerned about knowing about the vaccination, you can ask her that, okay, first we usually do is we do the antibodies level in your blood, okay, to see if you have gotten any vaccinations in your childhood, because MenP is included in the UK vaccination schedule. So every child usually gets that. So what the occupational health team or the public health team, what they are going to do is occupational health team are usually the ones who deal with with any health issues that are going on with the person who is doing some work, like some job. So if you are a working person and you are having some issues regarding your work or your health issues, or you are concerned about something, you can go to your occupational health department and ask them, yeah, I want to get this vaccination, because you can ask, you can give them all the history that I'm really worried that my nephew has got this and maybe I would get it and I would transfer it to my students. So this is somehow related to your workplace. Okay. So here you can also go to your occupational health department, or as Dr. Pratima mentioned, your public health services. Okay. So what they are going to do, they are going to assess you for your antibodies level in your blood. Okay, so to see that if you need any booster doses or not, because every child usually gets these vaccination, pneumococcal, MenB, and influenza. Okay, so they are going to do the antibodies level, and then if you are not vaccinated, or if they think that you need booster, they will definitely give it to you, because vaccinations are for everyone, to protect everyone. Okay, so after that, ask about any expectation that she might be having apart from this, and then about the red flags or the safety net. So you need to mention about because this is um, um, a disease to be notified, and something that can cause even death if it's untreated. So it is a red flag disease. So you need to tell her about the symptoms, that if you develop any such symptoms in the near future, you need to come back to us or call 219. So safety netting in your consultation is important, especially in such cases where you are dealing with such diseases, which are deadly as well as notifiable. So you need to safety net in this scenario as well. And regarding the vaccination or the prophylaxis thing, you can tell them that I will be offering you some leaflets, so that you can have all the knowledge that you need on the vaccinations or the prophylaxis will be given here. If in any case you have any difficulty, you can come back to us again. Okay, so this is all about this station. Any difficulty or any problem in this station? All right. So let's move to the next station. Okay. So Dr. Obed, I hope you are here. Okay. So let's start with your performance, Dr. Okay. So regarding the telephonic consultation, okay, it was mentioned that she is on the telephone and she is calling you. Okay. So it was fine. It was fine asking her about her name and age and address, everything. Okay. And then because she is calling you, there is no need to ask her that is it the right time to talk to you, or are you comfortable talking to me, because she's the one who's calling. So that is why that is all understandable. And I like your grips of the telephonic consultation. That was good. Okay. So regarding the station. Okay. So you are well aware, Dr. Obed, that we need to hold this professional confidentiality of the patient-doctor relationship, and we cannot tell a single thing to anyone without the consent of the patient. Right?
Okay. Okay, yeah.
Okay. So you cannot even tell the mother about the visiting of Sarah to the GP surgery, which you repeatedly mentioned that yes, she came here. This is a bit that you are giving her a kind of you can say a kind of hint that she was here, and maybe we have prescribed her. So you broke a bit of confidentiality, right?
Okay. Okay.
Yes. So you cannot tell her about her visiting to the GP practice as well, because that is also confidentiality. You cannot tell anything regarding the visit, did she visited, any plans for that, anything else, anything. We cannot tell to anybody without the consent of the patient. Okay? So how to tackle this such kind of scenario where we are dealing with the confidentiality? So see, on just breaking this telephonic consultation, she started talking to you. I am concerned about my daughter. I'm concerned about my daughter. I want to talk to you about my daughter. Okay, tell me, what do you want to know about your daughter? Okay, so I found these OCPs at her bed, and I want to know that did she come to the hospital? Okay, so just tell her that unfortunately I'm not in a position to answer this question right now, because we do hold some confidentiality about the doctor-patient relationship, and unfortunately I won't be able to tell you about the Sarah visiting to the GP. But can you tell me why are you concerned about this, or why are you worried about her visiting GP? So she will tell you all the incident that she found the OCPs and everything, and you need to ask it yourself. Did you ask her? Because she's asking you about the OCPs. So you need to ask her that, did you ask your daughter about all of this? And then she's going to tell you that, yes, I tried asking, but she closed the door and slammed the door and didn't answer me, or anything, any story she's going to make up. Okay. It was very nice of you to say sorry about her daughter's behavior. That was very, very considerate of you as a doctor. Again, I really like that your point in your consultation. Your IPS was very good, and you tried to calm me down in all the throughout the consultation, because I was a bit hyper in the consultation. I was trying to drag you down again and again to just breach the confidentiality and tell me the truth. But you handled it really well with your IPS, I must say. It was
Thank
good.
you.
Okay.
Thank you.
Yes.
Thank you.
So you don't need to tell about her visit to the practice as well.
Okay.
And
No.
then ask her directly that, did you try talking to your daughter? So she would tell you that, okay, I tried talking, but she didn't respond to me, and that is why I am telling you. So here, empathizing and acknowledging her caring attitude that you rightfully did was very important, and that is how you are going to score high in your IPS. Okay. So she mentioned that she just closed the door and she left the house or anything. So just to be a bit more considerate, you can ask her, are you aware where she is now? Or
Okay.
do you know about her whereabouts? Are you worried about her? If you want, we can call her. We can talk to her about her whereabouts. Maybe we are not able to tell the mother about where the girl is, because it is also a part of confidentiality, but we definitely need to hear the safeguard of this 15-year-old girl is also involved, because she just
All
left
right.
the home. Okay, so try
Yeah.
asking the mother, did you call any of her friends, and are you aware where she is now? So the other person would get that this is the safe doctor. She is
Okay.
this doctor is trying to play safe for my daughter. Okay.
Okay. Okay. I get it.
Yes. Yeah. Okay. Then you mentioned the very, very right thing about confidentiality, and your use of words was also very justified and very good. Okay, I must say.
Okay.
Okay. So how are you going to take this consultation further on? Because she is going to bang you again and again there. No, I want to know, I want to know, I want to know. Okay. So how are you going to tailor this consultation? It is a kind of, you can say, taking and giving kind of situation. So you are going to bargain her against the confidentiality by telling her generally, how do we deal with such patients? How do we deal
Okay.
with such people at such young age if they ever come to us for any contraceptive pill? So, but we are going to say, would you like to know that if such young patients like Sarah, who's 15 years old, come to us for any sexual advice or any contraceptive pills, how do we proceed? Because I can see that you are really concerned about her as a mother, and I really appreciate that. That's very appreciative of you as a mother. So let me tell you that how do we deal with such patients? Okay, and then we are going to tell her that we assess the mental capacity of the patients to see if they are in the right state of mind to decide whether they can continue with their sexual activity or not. And once it is once we are sure that he is mentally capable of taking this decision, then we proceed further, and we do not involve we do not compromise the safety of the patients, such young patients, in our practice, because that is also a part of our professional duty. So what we do is we do the mental capacity assessment, and then we encourage such young adults to talk to their parents We repeatedly advise them, but we cannot force them, right?
Okay. All right.
We do advise them to talk to their parents at their ease, and sometimes they do talk to their parents. Okay, and then we assess that if they are going to continue their sexual activity with or without the pill, with or without the contraceptive any method. So we do assess that as well, because it is more harmful for her if she is not given any contraceptive pill or anything for contraception, and she continues having the sexual activity. That is even more detritus for her health, because she is going to end up being pregnant at such a young age, and this is going to definitely harm her more. So we do this as well. So you are going to make her mother calm down regarding this consultation and regarding the prescription of OCPs to this young age group, because she is bringing the legalities again and again that it's illegal, it's not right, it's not good. So you are going to tackle the situation like that we are equally concerned about the wellness and the goodness of our patient. So we do measure the positives and negatives of the situation, and then we go on with whatever is suitable for our patient, because we do not want her to end up being pregnant at such a young age. And it's always better to give her the contraceptive a year instead of her ending up being pregnant. Okay, so that is how you are going to. Okay, then regarding her relationship, you also need to mention and explain this to the simulator as well as to the examiner that you are a safe doctor and you know the safety of such a young girl at this age in the relationships. So you are going to mention her that we do assess the relationship status of such young people. We do ask about the age of their partner, the relationship of their partner, because we need to make sure that they are safe and they are not forced into any kind of relationship, because that is a safeguarding issue and we are going to need to involve social services then. So once you start telling the mother about these things that you are concerned, these are showing that you are acting as a safe doctor for the daughter, then the mother will calm down that, okay, the doctor is doing the right thing. He is also concerned about my daughter, and he's very right about the confidentiality. Okay. So once you start establishing this relationship of safety with the daughter, the mother will calm down and she will understand your points that, okay, this doctor is right about this. If he did all this research himself, then definitely my daughter is in good hands. So we do mention that at such young age groups, we do try to find out if the patient is in a safe relationship or if it is a forced relationship. So we do ask the age and the relationship of the partner with the partner, like how did they meet? If he's a class fellow or if he's someone more older than her, then we definitely involve social services, because that is a concern, safeguarding concern for the child.
Okay.
So that is how we are going to make sure that she is safe and healthy. Then sometimes the mother will raise concern that I am concerned about the sexually transmitted infections at such a young age, because OCPs are not going to control sexually transmitted infections. So you are going to address that. We are equally concerned about the sexually transmitted infections in this situation, and we do advise all of our patients who are taking contraceptive pills as a source of contraceptive measure to use condoms, because we are equally concerned about the sexually transmitted infections. So you will explain this that if this is your concern, it might have already addressed in her consultation, because we are ourselves concerned about that as well. Okay.
Okay.
So
all right.
sometimes sometimes the mother will also raise concern about the religious beliefs. Okay, so she will say that we are Catholic, or we are we have these kinds of religious beliefs. So how are you going to address these religious beliefs? You cannot do much for the religious beliefs, because people do hold different kinds of religious beliefs, and the doctor doesn't usually intervene in the religious beliefs. So you can clearly mention this to them. Unfortunately, I cannot comment on this, or cannot help too much with these religious beliefs, because everyone has their own. But we do take into account the safety of the patient.
Okay. All right.
We do whatever is best for our patient. Then she is going to trigger you by asking this question, that if she was your child, what would you do? If a patient asks you a direct question involving yourself, try to generalize the answer and not give a personal question. Like, I
Okay.
liked your answer that you said, I would be very worried as a parent if I were at your place. That was a right answer. That was a right sentence to speak here, because you are trying to calm her down with this question, with this statement.
Okay.
But how are you generally going to tackle this? Maybe how about we try to talk to her in a different environment? Maybe you can take her out on somewhere where she loves to eat, maybe a dinner, a dine out, or maybe if she is somewhere closer to her other parent, maybe the father or any other sibling, you can ask them to talk to her regarding this, and maybe she would open up to them. And regarding the behavior that she mentioned, that she slammed the door in front of her, maybe the mother, her tone would be intriguing, or she was worried. So maybe that the environment was not very good for her to answer all of these questions. So try to mention that to the mother, that create a safe
Okay.
environment for her, so that she will open up to you or anyone else. It's not usually advisable to talk to the community members or the other distant family members regarding this issue, because it is a kind of confidentiality for everyone, not for the doctor-patient relationship. A sexual relationship is a kind of very personal thing, right? So you cannot advise them to talk to any community person or any any distant family member. Just try to be close within the close family, like father,
Okay.
mother, sister. Okay,
Okay.
so
Okay.
this is option you can give to them, not very distant relatives. You cannot talk to like your sexual habits to a distant relative, right? So
Yeah.
it's not very good to mention any such thing here. Okay, then
Okay.
if she is more concerned, how about if we arrange a meeting together, with you and Sarah? How about if we have a meeting together with mother and daughter, and maybe Sarah would open up there? So you can talk to her in a safe environment. Maybe she will open up there. You can maybe ask her father or any other sibling to talk to her. Create a safe environment for her, so that she is comfortable in opening up. Or maybe we can arrange a meeting together with you and your daughter. If she gives the consent, only then we are going to give you the information about her, and that will be also how much she wants us to give it to you. So it's better that you discuss it with her on your own. Okay. So at the end, you need to again ask for any other concerns or any other expectation that she might be having in this consultation. But repeatedly keep on telling her that I'm so sorry that I am not able to help you with this. Unfortunately, my hands are tied and I cannot very much go into details of this. But at the same time, maintaining the ideas, you need to convey what you want to convey.
Okay.
Okay. So
All right.
that is how the scenario is going to be dealt with. Okay. So any question regarding this station or any other station? Everyone is more than welcome. And Dr. Abed, very best of luck for your exam, and I am really hopeful about you. You will do great job in your exam. Okay, just keep these little things in your mind, and you will definitely. Okay.
Thank you. Thank you.
No,
I think I have one question.
Yeah, sure.
So I was thinking, in your bid to let her know what you do in general, wouldn't the simulator possibly take it as, so that is what you actually do when people like this come to you? Are you getting it? Wouldn't you
Yes,
misconstrue it in a way?
yes. So this was the same concern that was raised in my mind when I was trying to prepare for this station in my when I was supposed to give the exam. So that was true. But what is more important to calm down her mother, who is really concerned about her daughter getting the OCPs. So she know that her daughter has OCPs, okay? But we are not going to tell her that we gave her or it belongs to her or anything. She is concerned that it is illegal at this age to have a sexual activity. And it is very important for her to understand that we cannot stop someone mere on a consultation to stop having sexual activity or anything. So what we are going to tell her, we are telling her generally what we do, so that she understands that if ever her daughter visited us or will visit us, she will be in safe hands. This consultation is all about calming down a terrified mother about her daughter. Okay, so once you are going to calm her down and tell her that we are acting safe for our patients regardless of their age, and we do investigate their relationship, she is going to be fine. Are you getting my point?
Yes, I'm getting it.
Yes. So you need to give a general overview, so the mother will calm down and she will come to know that, okay, if ever my daughter got this, she was properly investigated for it. We are not saying that yes, your daughter got it. We are saying that if such patients, if the patients of her age come to us, would you like to know how do we proceed? So it is not direct way of telling them that yes, you're not okay. And that is why I asked you that do not mention in your consultation that yes, Sarah visited. Do not mention.
Okay.
Okay.
Okay. Okay. Okay. Then my next question would be that how would you transition, okay, from answering that you cannot tell her if Sarah visited or not, to getting to the point where you now tell her the things that you do for such patients when they come to you? At what point?
Okay. So it is about, as I mentioned in my stage. Yeah. So she will be asking you, okay, I found these OCPs under the bed of Sarah. I want to know if she visited or you were the one who prescribed her. You are going to tell her that, okay, we are going to hold the confidentiality and we cannot tell you if Sarah visited or not and what was the visit about or not. Okay. We are not even going to tell her that Sarah visited or not. So it is all about confidentiality. And then she will say, definitely she is going to get hyper because you are not helping her. So how to calm her down in this situation? And at this point, you can tell her that unfortunately, I can see that you are very much worried about your daughter. But unfortunately, I cannot help you in revealing any kind of information regarding Sarah. But I can give you a general overview of such patients who are such an age and they present to us for any contraceptive advice. So would you like to know how do we deal with such patients? Ask her. She will tell you, okay, tell me what do you do. Then you will go on with this.
Okay.
Do you understand?
Yes, I understand. I get it. I get it.
Yes. Yes. So that is how you are going to tackle this consultation in your favor. You are going to take her along in your consultation and then let her like involve her in the consultation as if you are acting as a safe doctor for her daughter, and she will be all fine after that. And when you will be giving her options that how about arranging a combined meeting or maybe talking to her in a safe environment, she would be happy to accept it.
Okay. All right.
Okay.
Thank you.
So that was all about today's session. You're welcome, Dr. Ben, and all the best to you. We do also conduct paid mocks. So there are a few slots available for the July seats. You can DM me always for the details. And all the very best to you, all of you guys. And I hope you guys found this session very helpful. Do try to give us a feedback, and the candidates who perform, try to fill the feedback form. For that, you need to DM me or maybe message in the group so that I can send you the feedback form. All right.